What is Hashimoto's thyroiditis? Part 3. So, guys, we've been talking about what is Hashimoto's, how is it diagnosed, and what conventional treatment might have been used. We're going to go a little bit more into how it is treated conventionally. So just to summarize, for those that are new here, this is the first video you clicked on. Hashimoto's thyroiditis is a type of autoimmune disease. It is where the thyroid is functioning fine, but the immune system decides, I'm going to attack you because you look funny, okay? Well, not really, but you get what I mean. If you don't really understand, go back and watch the other 2 videos. Okay, so moving on. What we're going to be doing today is talking about how is it treated conventionally versus naturally, or what we call holistically. So, what I like to explain is you can treat thyroid symptoms conventionally, right? You can say, okay, well, someone's having palpitations, I'm going to give them something like a beta blocker to block that heart rate so that the patient cannot be having that discomfort. We can also just give the patient thyroid hormone, right? The most common one we prescribe in the US is called Thyroid or levothyroxine. There's a few more brand name ones that have come out since then that we also use, but most patients are on levothyroxine. And every now and then you'll find a more holistically thinking doctor that might recommend patient use the natural thyroid hormones like Amorthyroid, Nature Thyroid, West Thyroid, MP Thyroid. Those are natural thyroid hormones that are extracted from the bovine thyroid. So, why would I pick levothyroxine or Synthroid versus picking a natural thyroid? One of the most common reasons we do the levothyroxine is because it's very easily accessible. A lot of insurance companies pay for that, and so when we find a patient that their thyroid is not functioning very well, where it's low functioning, as in the case of Hashimoto's, we prescribe them Synthroid or levothyroxine. Okay, so I want to explain what that is. Levothyroxine or Synthroid is a synthetic T4. So in my other videos, I explained what T4 is, what T3 is. So T4 is the hormone that the thyroid gland usually releases the most of. But I explained in those other videos that T3 is also released, and there's other hormones that come out of that gland called T7, for example. But T3 is the active thyroid. So when we give you levothyroxine or Synthroid, we are not giving you the active thyroid hormone. We are giving you what's called the non-active. What we're hoping that your body is going to be able to do is take that T4 and convert it to T3 and then utilize it for what we normally do in the body. Well, what we've come to find out is there are a lot of patients that their gut is not that healthy, meaning that majority of this T4 is converted in the gut. In fact, there's some statistic that say somewhere around 60% or more of the thyroid T4 is converted to T3, right? Some parts of the liver, sometimes some part of the GI tract converts this T4 to T3. So if I have really bad GI symptoms, like I have irritable bowel symptom, or I have severe constipation, I have poor absorption, or some type of inflammation or candida in my gut that's really causing havoc in there, do you really think that my body is going to take that T4 and happily convert it to T3? So we have patients on thyroid hormone for years and years and years, and they still feel like crap. They don't feel good. They're still tired. All the symptoms that they went to the doctor with, it's still there. But guess what happens to these patients? When they get back to the doctor checks the blood work, and he's like, oh, the thyroid levels look good. We're good. Right? Why? Because the T4 is showing up in the blood work. The T4 that you're taking every morning is showing up in the blood work, and the level looks good. And the doctor's like, yeah, we fixed it. But you're like, but I don't feel better. Like, I'm still constipated. I still can't lose a pound. And my temperature is still off. I'm still spontaneously aborting my babies. that I'm not okay. But the doctor's like, but the test looks good. Well, yes, the test looks good, but what needs to be checked at this point is, are you converting your T4 that we're giving you to T3? So if you're in this boat where you've been going to the doctor, they gave you levothyroxine, they gave you Synthroid, and your symptoms are not improving, you need to demand that your doctor maybe look at your T3 level. Because if your T3 level stays low, you're not going to feel better. Because the T3 is the active thyroid that actually does the work within the cells. Okay? So, now, let's say your doctor did check your T3 and your T3 looks fine, but you're still symptomatic. Here's something else to consider. In the natural thyroid hormone, like the ones that I mentioned earlier, amothyroid, the NP thyroid, Westroid, nature thyroid, those natural hormones, what we find when we look at the components of those hormones is that there are other ingredients in there. It's not just T3 and T4 in there, there's also T7 and a few other things. Well, some patients respond really well to those. And all of a sudden, we switch them from levothyroxine to these natural hormones and they start to feel better. So what that tells me is either they have one, maybe a conversion problem where they're not converting that synthetic T4 to T3, or their body needed the other ingredients inside of that natural thyroid for their thyroid to seem to work better. So that might be something that could be tried in your situation. If you are Hashimoto's thyroiditis or just hypothyroidism, and you've been taking thyroid medication, the synthetic thyroid medication, like the Synthroid or the levothyroxine, and you're just not getting better, it might be worth switching over to a nature thyroid so that we can see whether your symptoms improve. There are other things we can also check. One test called reverse T3 that the doctor can check to also see how your body is actually functioning. So, not to go too long into the explanation of this, I hope that makes sense. That is the conventional way of treating it. And now let's talk about the holistic, natural way of treating it. So, a lot of my patients know that I try to use food and lifestyle changes and addressing the underlying cause as the way of treating disease. So when it comes to Hashimoto's thyroiditis or this autoimmune thyroid disease, the question I ask myself is, wait, by just giving this patient thyroid hormone, I've now bandaged the problem, right? I've covered it up, I'm giving them hormone replacement, but I haven't addressed the fact that it is the immune system that needs to be addressed. So the conventional way of treating just band-aids the problem, but the holistic way of treating the problem is saying, hey, let me do something to help the immune system out. Because if I help the immune system out, then maybe it will stop attacking the thyroid and then the thyroid can continue to make the hormone on its own. Doesn't that make logical sense? So here's the approach. We say, okay, what are the most common causes of autoimmune disease, right? What triggers, what do we know causes autoimmune disease in the body that I can address that might start to get my immune system better so that I can stop attacking my thyroid? Okay, so here's where we go into looking at, okay, what are the causes? Most of the time we know that the immune system can start acting weird if it's exposed to weird viruses. We know that the immune system does not like heavy metals. We know that the immune system doesn't like toxins in general, right? Environmental toxins. We know that the immune system doesn't like food allergies, right? We also know that the immune system does not like stress. The immune system doesn't like vitamin deficiencies, like vitamin D deficiency, okay? So those are the approach that we take when we deal with this holistically. We say, hey, let us address any vitamin deficiencies you have. So we run a pattern of vitamins. We make sure that all your vitamins are within optimal ranges. Your vitamin B complexes, your vitamin D. We want to check your iodine level. We check a lot of different things to make sure that they're all optimal. We fix those. Then we address your stress. Hey, if you're taking on too much, you need to slow it down. Okay, you need to have time to relax, time to, for self-care. You need to meditate, you need to pray, right? You need to relax, you need to exercise to de-stress, right? Then we talk about, okay, what are toxins that you're potentially exposed to? Do you have some mercury fillings in your mouth, or what we call silver amalgams, right? They're not really silver. It contains mercuries, especially if you've had it put in 10, 15, 20 years ago. At that time, we were adding a little mercury to those fillings, okay? So you need to go get that checked, maybe potentially removed by a biologic dentist, okay? So that they don't release the toxin back into your body. So you have to address those things. So we remove toxins, we remove mercury, heavy metals. We also look for chronic viruses. Yes, chronic viruses, things like Epstein-Barr virus, things like herpes virus, right? Those can also stimulate the immune system to start attacking your thyroid. What about the food? The food allergies. One of the most common ones we find is gluten sensitivity. It doesn't have to be celiac, but celiac is definitely worse. But it could just be sensitivity, that your body just doesn't like this gluten molecule. Or maybe because it's the GMO gluten, right? Your body doesn't like it, so you have to remove that from your diet. We commonly find patients with dairy sensitivity that also develop Hashimoto's. So we try to remove those things from your diet, we remove those toxins from your body, we replenish vitamins deficiencies, and all of a sudden, guess what? We recheck your antibody level or your TPO, thyroid peroxidase antibody level, and voila, the level is going down. And we're saying you're in remission. Isn't that great? So without having to treat you with a new medication, we can actually address some of these underlying causes and get your thyroid functioning better. So I want you to join me on the next video, because we're also going to talk about who is most likely to develop Hashimoto's thyroiditis. Join me on that video. Comment in the section below if you have any questions about some of the stuff that we talked about on this video, or if you've experienced this. Are you on Synthroid? Are you on levothyroxine and you've not been feeling better? Let's talk about it. Maybe we need to switch you. Maybe you can help educate some patients that might be dealing with the same thing that have not had this addressed. All right? I'll see you on the next one.